morning. I'm here to some degree under false pretenses, as I will explain. Let me proceed and keep in mind the title of my talk, which is A Tale of Two Centers. The Center for Demography and Ecology, CDE, at UW-Madison celebrated its 50th anniversary in 2012. So it's been active for about 57 years now. The Center for Demography of Health and Aging, CDHA, or as I hoped it would be called, Cheddar, is its younger sibling, now celebrating 20 years with many more to come, I really hope. CDHA would never have existed were it not for CDE. And it would never have existed were it not for the most brilliant and innovative federal program officer I have ever known, the late Richard Sussman. And I'm going to say quite a few words about him here. Richard was an immigrant from South Africa, Harvard-trained in sociology, who quickly left academia for appointment in the Office of the Demography and Epidemiology of Aging within the National Institute on Aging. Richard was a hard case, ambitious, abrasive, and persistent, but not without a sense of humor. He often referred to himself as an African American. By the time of his death, he was Director of Behavioral and Social Research at NIA, with a budget larger than the entire social and behavioral and economic research unit at the National Science Foundation. Richard had one great idea after another, and he brought them to fruition. His greatest idea was to combine longitudinal studies of aging, social, psychological, and economic, with new developments in biology, epidemiological, medical, and genetic sciences. This led to his capture of the Wisconsin Longitudinal Study in the early 1990s, and at about the same time to the founding of the Health and Retirement Study at the University of Michigan and its dozens of clones around the world. Another of his interdisciplinary innovations was to couple studies of human aging with the aging and survival of other species. For example, in his unit sponsorship of the classic National Research Council report, Demography of Aging and Between Zeus and the Salmon, Richard used the capacity of the National Research Council to drive scientific innovation by sponsoring more than 30 of its reports over a quarter of a century. Anyway, ever mindful of costs and in line with his practice of connecting with successful elite institutions and individuals, he would never form a committee without Angus Deaton on it. Sussman undertook to build institutional capacity for research in the demography of aging by complementing and supplementing the several NICHD-supported centers for population research. Linking to NICHD population centers was an interesting tactic or strategy. He was averse to collaboration with other NIH institutes for fear they would steal his thunder, and he just undertook that, I think, quite independently of NICHD. He just did it. Anyway, that's what led to the founding of CDHA. He first invited NICHD population centers to apply for exploratory centers in the demography of aging using the NIH P20 grant mechanism. Bumpus led that center for a few years. And Janet and I, and among others perhaps, have been trying to figure out exactly when Larry first got that exploratory grant. And the university doesn't seem to have any records before 2000, which is exactly what we needed. So much for history. And Larry hasn't told me the answer to that question anyway, but if anybody deserves credit for really being the founder of the aging component of CDE, it really is Larry, it's not me. What happened was that Larry declined to serve he led that center for a few years, and it was sufficiently successful for Sussman to invite an application for a 5-year P30 center grant. That was the big deal. Larry declined to serve as PI of the new center. After failing to locate another volunteer, and consistent with my longstanding inability to say no to any challenge other than departmental leadership, I agreed to take on that task. So, in collaboration with any number of colleagues and staff, and you've heard how things got put together in the nick of time, we prepared the first 5-year P30 application. The abstract of that proposal tells much of the story of CDHA. The Center for Demography of Health and Aging at the University of Wisconsin-Madison will complement the Center for Demography and Ecology, one of the NICHD-supported P30 centers for demographic research. CDHA will both share and build on the substantial research infrastructure of CDE. It will create new links between social demography and biomedical and epidemiological research on aging. The overall goal of the CDHA will be to build a major research and training program in the demography of health and aging. Major themes of ongoing and developmental research activities within CDHA include midlife development and aging, economics of population aging, inequalities in health and aging, and international comparative studies of population aging. These cross-cutting themes build on current activities of members of CDHA. And then it goes on to describe the several cores. That's a term that NIH imposes on us to say, you know, these different things have funny names that nobody really understands. Anyway, so much for that. I guess I should say they were, what, administrative, program development, external innovative network? What the hell was that? External research resources, statistical data enclave, and so on. The most important resource of CDHA was, of course, its people. I drew on many professional and scientific acquaintances, going outside the UW-Madison in a few instances, in order to create an initial membership of high quality and broad interdisciplinarity. This was very much in keeping with the way in which several of the Madison centers and institutes operated. We were all largely dependent on external support, accepting the sparse and conditional benefits of the annual graduate school competition. Standard practice was for many of us to affiliate with multiple research units, thus creating opportunities to present our ideas to external funding organizations in any way that might be attractive to them. The initial membership of CDHA was both large and diverse. Disciplines included sociology, demography, economics, medicine, epidemiology, psychology, psychiatry, and actuarial science, among others. And I'd read the list. I noted that several of those worthy souls are no longer with us. Let me mention some of the names. Bill Aquilino was on it, a guy named Mark Brown, who was in the business school, professor of risk management and insurance, Larry Bumpus, of course, Molly Carnes, Karen Cruikshanks, Don DeLesio, Martin David, Jed Fries, Denny Fryback, Jan Greenberg, Karen Holden, Sean Canayo-Puni, David Kindig, Nadine Marks, Jerry Marwell, John Malahy, Alberto, he's with us, Pat Remington, Roberto Reaper-Teller-Muller, Stephanie Robert, who couldn't be with us today and was supposed to be, was in that first cohort associated with CDHA. She was just an assistant professor back then. Marjorie Rosenberg, who was basically a biostatistician, Carol Riff, Gary Sandifer, Nora Kate Schaefer, and did I mention, no, never mind. So much for that. In some sense, and not by accident, the two centers, CDE and CDHA, were one. And the junior partner was intended both to complement and supplement the resources and activities of the founding partner. In this connection, it's important to remember the basis on which CDE was founded, one of the great ideas of Hal Winsborough, that it was a research cooperative created to grow resources and activities by sharing them and with an absolute minimum of member or project-specific accountability. Of course, the main mission of CDHA was to promote research, both by supporting existing projects and creating new ones that would contribute new ideas, methods, and findings, and thus warrant NIA support, And there were already several NIA-supported projects within CDE, and those were undoubtedly attractive to Sussman when he agreed to let us write the P30 proposal. There were 2 R01 grants for, the NSFH, National Survey of Families and Households. There was the Wisconsin Longitudinal Study, and then there were some R03 grants. Alberto had one on health conditions of the elderly in Latin America, Gary Sandifer on work, family, and health, Marcia Seltzer on life course impacts of non-normative parenting. Moreover, CDE, as David mentioned in his memo, we already had a small NIA-supported training program in the demography of aging. At that time, it supported only 2 pre-docs and 1 postdoc. But after CDHA was founded, we were successful in obtaining additional training slots. And then new projects were to be created through a program development core. That is to say, we were able to decide, originally without much oversight from NIA, but later things changed, we were basically able to act as a secondary granting agency to create new projects that might eventually lead to NIH support. And in that first year, the grant period, we did not offer a specific menu. We just gave a bunch of ideas. We just threw a bunch of stuff in the air and said, well, maybe a bunch of these will get money from us once you give us money. And I've got a list of some of those. Bill Aquilino had something on the nest emptying process and parental well-being at midlife. That was consistent with Tanya's doctoral thesis, in which she summarized as parenting sucks. Karen Cruikshanks and the epidemiology of age-related hearing loss and visual impairment. Carol Riff on life histories and their physiological signature in the elderly. Gary Sandifer on social support and well-being. Then we had Martin David measuring the value of kinship networks for support of people over 65. Jed Fries on Social Security financing. Marjorie Rosenberg and Denny Fryback on the use of Bayesian methods to compute community-oriented, health-adjusted life expectancy. That's still, last I heard, it was still a hot topic. Another name you might have heard of, John Carl Schultz. Anybody ever heard of that? The adequacy of retirement income over time and the contribution of Social Security in an era of reform. And then we had David Kindig at what rate, can black and white mortality disparity be reduced or eliminated? Don Libby and Kindig on a multi-level analysis of socioeconomic determinants of morbidity and mortality using the National Health Interview Survey. Karen Swallen on residential mobility and health. Sean Kanaya-Alpuni, living arrangements and remittance patterns of Mexican households. Susan DeVoe and Gary Sandifer, comparative study of family and households in 5 European countries. And Alberto, health of Hispanics in the U.S. and their relatives living abroad. So that was our menu. Then we had this external innovative network core, which proposed again, those are NIH's terms, not ours. We had proposed 2 independent activities. One was a promise to hold regular workshops, conferences, and visits. Scarcely innovative, but worth doing, so we said we'd do those things, and we did. And the idea was to include foreign as well as domestic scholars in those activities, but far more innovative was, and this is where Jack comes in, was to, quote, develop a networked current awareness service for research in the demography of aging. That service, known as CAR, for Current Awareness in Aging Research, has been a grand success, and I still subscribe. CDE subsequently added its own awareness service project covering more areas of demographic and related issues. 2 of the supported cores were not so successful. We hired a data librarian and analyst, quotes, expert in the use of large-scale public data resources in the demography of health and aging and in the use of major statistical packages, end quotes. Unfortunately, and I bite the bullet on that one, our hire did not have the right package of skills, substantively, technically, or interpersonally, and that position fell by the wayside. The same individual was assigned to the Statistical Data Enclave Core. a facility for the analysis of sensitive data under secure conditions. The problem for which the data enclave was the proposed solution was serious then, and it remains so. It's been addressed with a variety of potential solutions ranging from closed or remote access schemes, such as the one we had in mind, to schemes that combine direct access to synthetic data followed by indirect application of proposed analytic tools to real data. Research with sensitive data raises two problems. The first is data security, and the second is the resistance of researchers to analyze data that they cannot massage directly. When CDHA began, I had little sympathy for those who would only work with data that they could manage and analyze interactively. My mentor, Otis Dudley Duncan, had carried out all of the analyses reported in his classic work with Peter Blau, The American Occupational Structure, using tables specified by them without any access to the data collected and later tabulated by the Bureau of the Census. Can you imagine doing research like that now? Nobody has the, to do that. There's a term in Yiddish for it, but I don't remember it anymore. Moreover, because earnings histories for men in the Wisconsin longitudinal study had been obtained from the Social Security Administration, because Bill Sewell knew the person who was in charge of research at SSA, without permission of the participants. And the research monograph that Bill Sewell and I wrote early in my time at Madison was similarly based on analyses that were carried out indirectly, subject to inspection of output by others in the central computing facility of the university. That's before we had our own computing. Or we may have had something, but we couldn't use it for this purpose. I'll tell you something else about that book. It was the first book I ever had my name on. It was a big deal. And one of my sons, who was a university professor, was wandering around his campus one day and bought a copy of it for me for 25 cents. So that was a lesson. Anyway, back to data analysis. Yet another factor in my thinking was that not long after I arrived in Madison, I was able to carry out almost all of my analytic work by writing out tabulation specifications that would actually be carried out by research assistants. Thus, I came late to interactive data analysis. In the case of CDHA, we equipped a very small windowless office on the third floor, I think, with a non-networked state-of-the-art PC and printer. All data were to be encrypted, and only two individuals, the librarian, analyst, and the statistical programmer, had keys to the room. I did not. Not even UW security officials or custodians had access to the room. We built it, and no one came. There was simply no willingness on the part of our investigators or potential visiting researchers to work with data that they could not manage and analyze interactively. It's just part of the story of the moral decline in our nation. Having looked at competing and non-competing renewal applications, I think it's fair to say that we, and I mean all of us who were affiliated with CDHA, did pretty well at what we promised to do. It would be tedious, I think, to list all the projects and activities that took place when I directed CDHA. I think that I was involved in altogether in three P30 5-year applications, 1998, 99, 2004, and 2009-10. The mission and framework remained much the same throughout those years. Self-plagiarism is not a recognized crime in proposal writing. During my time, there were, but the last of those three actually had Alvaro rather than me as PI because I was on my way out. Having gone thus far, one might think that the two centers referenced in the title to this little essay were the Center for Demography and Ecology and the Center for Demography of Health and Aging. That was not my idea. Those two entities basically operated as one, sharing resources, subject to the same rules and expectations, with highly overlapping staff, membership, and governing bodies. In fact, throughout my time in Madison, and despite their broad membership, both were housed organizationally within the Department of Sociology, and thus also within the College of Letters and Science. Our presence in L&S was advantageous because we had a clear expectation of regular annual returns of a percentage of the overhead created by our externally funded projects. And despite their informal recognition within and outside the university, neither center was actually recognized as an organizational entity by the university. I once had a discussion with a guy named Steve Butts. That's a famous name, by the way, in the history of this institution, who was then in the Office of Budget Planning and Analysis, saying, Steve, can you find a record of the existence of CDE and CDHA? There was no such entity anywhere in the university's records. Anyway, I aspired to land greater institutional support for CDHA, and the obvious target was the graduate school. I had several cordial talks about that possibility with my friend, former student and colleague, Martin Cadwallader, who was then Dean of the Graduate School. But we could not agree. As David Featherman explained in his prehistory of CDHA, the graduate school had committed to support the Institute on Aging, which was a unit within the graduate school. And Martin would not agree to provide additional support for CDHA unless it joined the graduate school, that is, became a unit of the Institute on Aging and abandoned CDE and the Department of Sociology. For any number of reasons, not least among which were the fruitful connections among CDHA, CDE, and sociology, I could not agree to that. Thus, during my time in Madison at least, there remained two independent centers for behavioral, social, and biosocial research on aging, one within L&S and the other in the graduate school. Thank you.